Hello friends, welcome again to Dr. Osman's EduTrends. Hope you all are doing well. Dear friends, as we all are aware that any patient who experiences difficulty in breathing faces lack of oxygen in body and patient is immediately attended with providing oxygen. When patient cannot breathe properly or when they cannot breathe on their own at all, then a ventilator, which is a machine used to help the patient's lungs work. It's used for breathing problems that can accompany a variety of conditions. Other names for ventilator are respirator, breathing machine, mechanical ventilation. Friends, let us see when a ventilator is used. A ventilator is used generally while undergoing a surgery where ventilator can temporarily do the breathing for you while you are under general anesthesia. It is used when recovering from a surgery. Sometimes people need a ventilator to help them breathe for hours or even for days after surgery, when breathing on your own is very difficult. A ventilator can help a patient breathe if patient is having lung disease or another condition that makes breathing difficult or impossible. Some conditions that may need the use of ventilator includes myasthenia gravis, sclerosis, brain injury, collapsed lung, chronic obstructive pulmonary disease, we call it as COPD, drug overdose, premature lung development, especially in babies, stroke, upper spinal cord injuries, and coma or loss of consciousness. Ventilators have also been used on some patients diagnosed with COVID-19 during 2020 pandemic. This is only for the most severe cases. The majority of people diagnosed with COVID-19 will experience mild symptoms. Friends, let us see how a ventilator works. A medical ventilator uses pressure to blow oxygenated air into the patient's lungs, remove carbon dioxide from the body. A breathing tube connects the ventilator machine to patient's body. One end of the tube is placed into the patient's lung airways. That is called as intubation. In some serious cases or long-term conditions, the breathing tube is connected directly to the windpipe through a hole. Surgery is needed to make a small hole in the neck, which is called as tracheostomy. Ventilators usually need electricity to run. Some types can work on battery power. The airway includes your nose, mouth, throat, voice box, windpipe, and lung tubes. We call it as bronchi. Friends, let us see how a patient is monitored who is on ventilator. If a ventilator is used, then there will be a need of other medical equipment that monitors how patient is doing overall. Patient may need monitors for heart rate, blood pressure, respiratory rate, that is for measuring the breathing, oxygen saturation, and also chest x-ray or scan. Additionally, patient will be undergone blood test to check how much oxygen and carbon dioxide is available in the blood. Being on ventilator when patient is conscious can be very uncomfortable. Person being treated can't talk, eat or move around as connected to a ventilator machine. The consulting doctor may give patient medications that help him or her feel more relaxed or comfortable. These help being on a ventilator less traumatic. Those who need ventilators are often given pain medications or often given different kind of medications. What could be the risk of being on ventilator? A ventilator can save a patient's life. However, like other treatments, it can sometimes cause side effects if we use a ventilator for a long time. The main risk of using a ventilator is infection. The breathing tube can let germs into the lungs. This can raise the risk of getting pneumonia. Sinus infections are also common if patient has a mouth or nose breathing tube. Patient may need antibiotics to treat pneumonia or sinus infections. The breathing tube can rub against and irritate the throat or lungs. It can also make it hard to cough. Coughing helps to get rid of dust and irritants in the lungs. Both kind of breathing tubes pass through the voice box, that is larynx, which contains the vocal cords. This is why patient cannot speak when fixed with a ventilator. The breathing tube can damage the voice box. It is advisable to inform the doctor if patient have difficulty in breathing or speaking after using a ventilator. A ventilator can cause lung damage. This can happen for several reasons. For example, too much pressure in the lungs, pneumothorax, that is the air is leaking into the space between the lungs and chest wall. Oxygen toxicity, that is too much oxygen in the lungs. Other ventilator risk includes skin infections and blood clots. So we came to know that ventilators are breathing machines that can help keep your lungs working. They can't treat or fix a health problem, but they can do the breathing work for you while you are being treated or recovering from an illness or health condition. Ventilators can be life-saving and an important part of treatment support for babies, children, and adults. How long we use a ventilator depends on how long we need help breathing or how long it takes for our underlying condition to be treated. Some people need a ventilator for short-term care, others may need it for long-term. You, your doctor, and your family can decide whether using a ventilator is best for you and your health. So friends, I hope this video is informative to you all. We will meet again soon with another informative video. Thank you.